Vaginal restoration, vaginal rejuvenation, the most state-of-the-art newest technique is laser vaginal rejuvenation. And what we're doing is we're restoring, rejuvenating the vagina back to its original state. The typical patient I have is generally an elderly mother, meaning a woman in her 30s or 40s, who's had at least one child, if not 2 or 3.
My age is 43 and I'm the mother of 2 children, ages 20 and 11.
And didn't bounce back. Because she's older, she doesn't bounce back as a younger patient might have after a vaginal delivery.
They were both vaginal births.
Most women after childbirth desire to have laser vaginal rejuvenation because the vagina is stretched out and sex just doesn't feel the same to both the patient and to their partner.
During sexual intercourse, it did not feel like it did before my giving birth to my children. So there was a very big difference, huge difference in that. So I felt it was very important to me.
Other problems that happen with the vaginal tube, the vaginal canal, is that some women develop urinary stress incontinence. They urinate when they cough, sneeze, laugh, exercise. They can't hold tampons, and it becomes a problem.
The weights were 9 pounds 10 ounces and 9 pounds 11 ounces, so almost 10 pounds. Very big babies.
The degree of stretching in the vagina is really related mostly to genetics and to age, meaning that a woman who has a 6-pound baby versus a woman who has a 10-pound baby, believe it or not, the 10-pound baby patient could bounce back to where she was, and the 6-pounder is very expanded or dilated. And so it's really more of a genetic thing. Some women win the vaginal dilatation or expansion lottery, so can't tell you who's who. Some women who have episiotomies, they generally might not stretch as much as a woman who did not have an episiotomy, but there still is some stretching involved.
The surgery that Dr. Jason performed was vaginal rejuvenation.
And basically what I'm doing in the procedure is I'm opening up the vaginal cavity and the outside of the cavity. I bring the muscles back together, okay? I trim some of the vaginal skin or vaginal mucosa, okay, and I restore it all. So it's kind of like a facelift, okay? You bring the muscles back together, okay, trim some skin and bring it back together.
I realized that when I had chosen my gynecologist, Dr. Jason was the doctor that performed these surgeries. And it was a matter of me feeling very comfortable with him and knowing him for a while, that I just felt I could trust him, and he was just very gentle, and I think he's a great doctor.
The surgery I perform is from a traditional type of surgery that's been done by OBGYNs for 70 years with numerous modifications. And by using the laser, we've made it an outpatient procedure, we've made it almost bloodless, and our techniques makes the first day or so pretty painless, and then afterwards we can take care of most problems with oral pain oral pain medication. Generally speaking, the recovery time for this procedure is about 6 weeks. Sometimes if a patient is in their 40s or 50s, it might take 7 or 8 weeks for them to recover fully till I'll recommend them that they can resume sexual relations or intercourse. Other reasons why women might look into vaginal reconstruction or laser vaginal rejuvenation is that sometimes the external part of the vagina, the vulvar, the labia might become elongated from vaginal deliveries, the vulvar structures can be distorted, and we sometimes do another procedure called designer laser vaginoplasty, which we modify periclitoral tissue, subclitoral tissue, labia minora, labia majora, the whole vulvar structure areas, to design it so to either bring it back to the way it was pre-pregnant or to the way the woman would like it.
I think it's very beneficial, especially for women who have had vaginal births. There is a huge difference. I'm happy. I would definitely recommend it.
Women don't have to suffer anymore, okay? And we can restore them to the way they were, okay? And they don't have to be embarrassed, and they can once again enjoy their sex life like it was prior to their first pregnancy.